So we wanted to know a little bit more about these areas and what might be the underlying conditions that are spawning this demand for services. Next slide. So we asked ourselves, how much does place matter? I mean, in what we need to do. In other words, you can look at these places and see things and think, oh, well, that's too bad. There's no fresh fruits, there's no parks, there's no sidewalks, and there's a lot of crime. That's unfortunate. But we need to print more brochures to tell people, to avoid these things. Next slide. Hit it again. So this is the hardest part, particularly for people, and forgive me for the ATSDR folks. They're actually pretty good about this, but for our friends at CDC, our friends at NIH, our friends in the federal government, our friends in the state government to understand that risk behaviors don't occur in a vacuum. It's not just about individual responsibility. So our theory is, and it's really not that radical a theory, is that the context in which you live shapes your opportunities and constrains your choices. And this is really about odds. It's not about, yes, it's all individual responsibility. No, it's all about collective responsibility. It's about the odds of being able to pull yourself up by your bootstraps when the conditions in which you find yourself are constantly working against you making those healthy choices. So does something shape risk behaviors in communities? I mean, it doesn't seem radical to people that are outside public health. But for people in public health, it's like, really? It's not all about, oh, wow. I mean, literally, not, they're much more forward-thinking people in public health, but if you look at our practice, it wouldn't suggest that we think that way. Next slide. So we think that conditions in neighborhoods matter. And we think that, hit it a couple times, we think that the physical environment matters, we think the social environment matters, hit it again, we think that the degree of residential, racial, and income segregation matter and matter a lot. Next slide. Okay, I told you about, we talked about the data on the 10 to 15% genetics, 10 to 15% access to healthcare. This comes from Journal of the American Medical Association, 1993, and this very distinguished gentleman who I've met on several occasions and I love, he's one of my mentors, by the name of Bill Fahey, produced this relatively radical statement in 1993 about what we actually should be focusing on in public health. It was relatively radical back then because it said basically that healthcare was only about 10% of the problem, and that we spent way too much time focusing on doctors and hospitals and clinics, and not enough time focusing on these other things, particularly lifestyle. At one time, he gave environment about 19%, biology or genes about 20%. Since that time, there's been a burgeoning, actually an explosion in the field of epigenetics. And this is as sciencey as I'm going to get, I promise you. Epigenetics is the field of essentially studying how DNA actually expresses itself differently in different environments. And through a variety of different mechanisms, one of which I'm going to talk a little bit about, essentially stress. That when you're under chronic stress, your DNA actually changes. It gets methylated in the scientific parlance. And that methylation, that change to your DNA actually changes the way that it expresses itself. So stress can actually turn off genes or turn on genes or change the way that they manifest themselves. So the notion that there's this hard boundary between environment and biology is false. And increasingly we're recognizing that nature and nurture are not two separate concepts, that they're both interacting concepts. And that's an important thing to consider because when you think about these things being genetic, you think, well, there's nothing I can do other than find some drug that alters the expression of a gene or changes the outcome of a gene. But if you recognize that the environment shapes genetic expression to a not insignificant extent, the environment becomes all the more critical. Hit it again. The other thing that's important and what we're recognizing, and many people recognize outside of health and public health, is that the environment also shapes lifestyle. And the choices, the individual choices that people make about these health behaviors that we're always printing brochures about. Next slide. Okay, so here's one of the mechanisms that we think is important. This whole notion of what we call allostasis or allostatic flow. That stress, and that stress can be mediated through any number of different sort of, next slide. Sorry for the non-scientific people. This is as much science, I promise, as well, I'm lying, there's more. This thing called the hypothalamic pituitary axis. people have probably heard about cortisol and adrenaline. Those are hormones that help us respond to fight or flight. Basically, when we're challenged, when we're frightened, when we have to defend ourselves, when we're at risk, we release these hormones. Hit it one time. The stressor stimulates the hypothalamus. Hit it again. The hypothalamus stimulates the pituitary gland. Hit it again. The pituitary gland stimulates your telephone. And one more time. And the adrenal gland releases cortisol and some other hormones that affect multiple organ systems. And for the sake of making a long story short, this chronic stimulation of this axis actually causes downregulation, which is another scientific term, turns down the sensitivity of this mechanism so that smaller stimuli stimulate a larger response, and the larger response becomes kind of chronic. The fact is that this response basically causes premature aging of the body system. It causes wear and tear on all of the tissue and organ systems, premature atherosclerosis, aging for many of the body's organ systems, downregulation of the immune system and suppression of it, and ultimately makes the physiological being more susceptible to disease over time, particularly chronic disease. So this is a physiological mechanism that is hypothesized to be the manner in which the outside world becomes internalized physiologically inside the body, and can explain some of the differential distribution of disease in populations that are exposed to differential levels of chronic stress. Next slide. Okay, so I told you we also took these death certificates in it again. We can use the death certificates not just to look at life expectancy over time, we can also look at life expectancy at a moment in time geographically. And what we've done here is actually created three categories of length of life. We use red, yellow, and green just to make it nice and simple. The green areas in Alameda County are areas where life expectancy is on average over 80 years. The yellow areas are life expectancy between 74 and 80 years, and the red areas are areas where life expectancy on average is less than 74 years. So the first thing you can see is that death concentrates in Alameda County. We have hot spots of death, which is surprising because if you ask your average person, on the street, do you think death concentrates in this county? They would say, I don't know what the hell you're talking about, first of all. But secondly, no, death is random. I mean, anybody can be hit by a bus at any time. It's just when God wants to take you, it's your time, your number is up, blah, blah, your ticket gets punched. But death, in fact, in aggregate, and this is what we do in public health, we look at aggregate, we look at essentially large macro trends that affect health. In aggregate, in Alameda County, if you give me your address, I can tell you how long you're going to live. And I'll be right most of the time. I'll be wrong occasionally. Somebody will, buck the odds. But for the most part, I can predict how long you're going to live based on where you live. And the interesting thing is you can do this in a lot of different places. Hit it one time again. This is Cuyahoga County, something that we generated just over the past couple of days. And here again, we look at the differential distribution of death in Cuyahoga County. And what you see, and it's stratified in four different areas. The dark green is 82.8, is that what that says? 82.7. The light green is 78.7 to 82.7. The pink is 72.8 to 78.6. And the red is less than 72 years. So it's sort of a gradient here. And the white is areas where there's either not enough data or we're still working on the data. But what you can see here is that life is not randomly distributed in Cuyahoga County either. And so what I'd like you all to do right now is find your house and then make your will. Okay, hit it one more time.